In this video, I'll be watching Principle 2. There are 3 videos for this section. Code of Conduct Principle 2, and this was mentioned in the previous video. So let's watch these together.
Welcome to the College of Nurses of Ontario, CNO, Principle 2 Learning Module, a section in the Code of Conduct focused on inclusive and culturally safe care. In the Code, Principle 2 states, nurses demonstrate cultural humility through self-reflection and evaluation of their own behavior. They advocate for equitable and culturally safe care that is free from discrimination. This includes understanding how personal attributes and societal contexts, such as disabilities, sexual identity, anti-Indigenous, and anti-Black racism, influence care. Principle 2 is broken down into 3 categories of core behaviors that nurses demonstrate while providing inclusive and culturally safe care. These include self-reflection, safer healthcare experiences, and training and education. Let's begin by focusing on core behavior number 1, self-reflection. Every one of us has beliefs and assumptions that we carry with us. Sometimes they are such a part of our daily lives that we are not aware of them. These assumptions and beliefs form a bias which can affect how we interpret the world around us and the people in it. By being engaging in self-reflective practice, we are accountable to safe quality care to clients. Self-reflection is important and allows nurses to become aware of the impact of their actions with clients. Take a moment to think about how your beliefs, clients, important and allows nurses to become aware of the impact of their actions with clients. Take a moment to think about how your beliefs, assumptions, and biases influence others and what steps you can take to address them. Another key area of self-reflective practice for nurses is cultural humility. Cultural humility is about taking a step back and asking yourself, what beliefs and assumptions did I bring to my interaction? How might those assumptions affect my perception and the client? And how might these assumptions influence my nursing care? Cultural humility is when nurses engage in self-reflection to minimize power differentials between them and their clients. It is an action that requires you to understand a client's cultural context from their perspective. Here are some actions you can take to incorporate cultural humility into your practice. Learn about other people's perspectives and cultures. Listen to the person's experience and ask about their healthcare concerns and goals. And think about how your values and beliefs impact your practice, and steps you can take to create inclusive outcomes for everyone. Self-reflective practice is also about seeking feedback and using it as an opportunity to learn and grow. Self-reflective practice not only impacts our relationships and behaviors with everyone we encounter, but it also helps identify opportunities for growth and change. Continue the journey with the CNO Creating Safer Healthcare Experiences module. Thank you for your ongoing commitment to client-safe module. Thank you for your ongoing commitment to client safety. Welcome to CNO's Principle 2 Learning Module, a section of the Code of Conduct focused on safer healthcare experiences. Let's learn how to create safer healthcare experiences. This is the second core behavior in Principle 2. Creating safer healthcare experiences helps address health inequities and racism that exist in our healthcare system. Health inequities are the differences in health status arising from the social conditions in which people are born, grow, live, work, and age. Racism is the belief that a group of people are inferior, based on the color of their skin or due to the perceived inferiority of their culture or spirituality. This leads to discriminatory behaviors and policies that oppress, ignore, or treat racialized groups as less than non-racialized groups. These historic issues have created societal power imbalances that exist today, including that between clients and healthcare providers. How can we as nurses provide safer healthcare experiences? By identifying health inequities and discrimination, as well as advocating and taking action. This action, a very important behavior, is called cultural safety. Cultural safety is an outcome based on nurses practicing cultural humility. It requires nurses to self-reflect on their own cultural identity and recognize the impacts this has on their practice. To facilitate a culturally safe practice, you may take some of the following actions. Address a client by their preferred name and pronoun. You can start by sharing yours. Remove language barriers and ensure appropriate supports are in place if needed. Engage your client in the creation of the healthcare plan. Listen to their needs and incorporate their values, cultural practices, and preferences into the care plan. Finally, the code requires nurses to report any error, unsafe behavior, unethical conduct, or system issue to relevant individuals, including employers, CNO, and other regulatory colleges, whether or not harm has occurred. Whichever course of action is appropriate, the expectation is that we do everything within our control to identify, prevent, and eliminate racist behaviors and practices. Continue the journey with the CNO training and education module. Thank you for your ongoing commitment to client safety. Thank you for your journey with the CNO training and education module. Thank you for your ongoing commitment to client safety. Welcome to CNO's Principle 2 Learning Module, a section in the Code of Conduct focused on training and education. Training and education is the third and final core behavior in Principle 2. The journey to understanding diversity, equity, and inclusion helps to support culturally safe care. In the Code, nurses continually seek to improve their ability to care. In the Code, nurses continually seek to improve their ability to provide clients culturally safe care. This includes identifying learning goals and activities that will help meet those goals based on their learning needs. Here are some reflective questions to help identify a starting point for your learning goals and objectives. Do I need more education on certain concepts or topics? Have I received feedback that identified a learning opportunity about subjects like cultural safety, cultural humility, or anti-racism? How do I approach my learning with humility that identified a learning opportunity about subjects like cultural safety, cultural humility, or anti-racism? How do I approach my learning with humility and self-awareness? And where would I find resources to help support me in my learning journey? These learning goals vary among nurses based on factors such as their own culture, personal and professional experiences. And this is why undertaking continuous learning in many areas is important. These areas include Indigenous health care, determinants of health, cultural safety, cultural humility, inclusivity, and anti-racism. When building your knowledge about inclusive and culturally safe care, consider completing workplace or self-directed learning and including it as a QA learning goal. In summary, this video series outlines the application of Principle 2 and the core behaviors: self-reflection, safer healthcare experiences, and training and education. Thank you for your ongoing commitment to client safety.